have them. Yeah, and I think there's also a breakout session at the end, right, Johnny? And I think there might also be pitches. So it's very interesting. It's for networking and pitching. So stick around after the event, even after the talks, to get connected to the community a bit more. So before we start, I just want to give a first thank you to Kumovis also for sponsoring the event. And we will also hear from Martin Herzmann later on in a talk a bit more about Kumovis and what they actually do. So I think I didn't forget anything organization-wise, I hope. And then we will start with our first speaker, who is Andrew Woodward. Yeah.
Okay.
I hope I pronounced that right. So
perfect.
Very quick intro to you. So he's been working in medical imaging for 38 years now, I've seen, and has been working since 5 years in advanced medical imaging lab, where he actually implemented the point of care 3D printing for patient education and surgical planning, right? And I've seen you have created already multiple models for complex surgical cases. So I'm very excited about your talk, and please share our screen and let us know what you've done so far.
Sure thing. All right. So I'm probably going to be the fastest of everybody that's here. So if you need me to slow down, certainly feel free to say that. And let's go over here. And is my screen shared? Let's try this. There we go. Did I manage to share my screen? Because this is my first Zoom meeting where I presented with. So my name is Andrew, and I'm in the Advanced Medical Imaging Lab at the University of North Carolina in Chapel Hill. And I'd spent most of my career either in the clinical setting or teaching medical imaging. And after 30 years of teaching, I wanted to go back to clinical, and I had an opportunity to come into the 3D lab that the University of North Carolina has. And in coming into that lab, we weren't doing any 3D printing. Everything was done in a virtual sense. And so the exams that I work with, we work with data sets from CT and MRI, and we cover the full spectrum of cardiac, endovascular work, orthopedic work, maxillofacial, colonography. We do organ volumes, but everything we just have massive amounts of data that we can work with. And we, in a virtual sense, we work with a software program called Terra Recon. And when I started, my goal was I want to build models. I want to be able to take that patient's anatomy and print it. And so we had to, I had to come up with a way to prove that we could do that. And no one in the hospital at that point had done anything. So in the beginning, I went out and I started with 3D Slicer, ITK Snap. They're free. As a state institution, we don't have a lot of money. Mesh Mixer, Mesh Lab, and Autodesk. And so working with all of the free software I could get, plus the software that we use to do our virtual modeling, I created a model and brought it forth and said, look, we can do this. Using on UNC's campus, we have maker spaces where they had 3D printers, which I didn't have at my point of care. And if you look behind me, when I come back on the screen, you'll see I've got some multi-makers behind me, and I also have a Form 3. So I went to the maker space, I loaded my file in, I printed this file out, I brought it back, and I put it in my manager's hands and said, we can do this. Can we find money and go to the surgeons? And at that point it was, sure, let's do that. And we moved forward at a cheap buy-in to begin with. And then we've kind of moved forward from that to, I now use Mimix Imprint as my point of care software for segmenting out my structures from the data. And my printer software, I work with Cura for the Ultimaker and Preform for my Formlabs device. I had originally started with a Form 2, and I now have a Form 3, which works out really well. And so we started with an Ultimaker 3 Extended, ran it nonstop. It did a great job for what we had. We had some questions. Can you make me a model that we can autoclave? Can we sterilize it? Well, there wasn't anything out of an Ultimaker that I could throw into an autoclave. It would all melt. So it was like, hey, there's a Formlabs that has a material that I could sterilize. So that allowed me to request, can we buy the Formlabs printer? And so we did. So now currently we've stepped up, and I have on a large build volume, the Ultimaker S5, and I'll show you some models when we get to the end of my piece that I use that for, but large body parts, spine, a pelvis, and those types of structures. The Ultimaker 3 doesn't get used as much anymore, but still gets used. And then my Form 3, which I use for all of my structural heart models. So whether it happens to be the congenital heart surgeon who's going to operate on that baby who wants cutaway models, or the adult TAVR placements or mitral valve placement studies will do that. Again, I have some examples I'll show you. So that's gone on well. We're not overwhelmed with work yet, but as the word gets out that we have this capability, more and more surgeons come to us and say, would you be willing to do this model for us? And I haven't turned anybody down yet. And patient education, we've done several models more for the pediatric patients because parents want to have a better idea of, and especially with congenital heart disease, what is it that's wrong with my baby's heart? So we'll print the models of the heart so that the parents can get an idea of what's there. Funding, because everybody always wants to know, what about money? You know, how did you manage to do this? Well, the fact is all of the models we do are free. You know, yeah, we have a lot of time in it. And we feel that the benefit to that patient in terms of reduction of surgery times, and the cost savings that are there, allowing other cases to go in, absolutely, you know, by far a greater benefit than not getting reimbursed for these models. Eventually we may get money for the models, who knows? But for me, it's the satisfaction of being able to create these models that will absolutely improve the care of that patient and the outcomes from that surgery. And recently we had some internal grant money to make some models, patient education models that they wanted done. Not a lot of money, especially, you know, when you look at some of the prices of printers, but enough that'll cover some of our expenses. So we continually look and wait to see what other funding is out there at this point in time. Our successful prints, truly amazing. And the surgeons say, we don't bring you the simple work, we bring you the most complex so that we can get an idea of what's inside that patient. On the orthopedic side, done a complete pelvis, done elbows, hips. For the maxillofacial surgeons on the oncology side, taking a mandible and mirroring it so that they can shape and bend their plates the way they want it when they go into surgery. And on the structural heart side, when we look at whether it's adult or pediatric, the ability to create these models so that the surgeon is able to get an idea of what they're going to find when they get inside. Because we have lots of virtual work and volume renderings that we can move through and fly through. But for all of the surgeons I've had that wanted models, they're like, there's nothing like holding it in your hand. And they are just, you know, grateful, and I'm grateful that they want us to do this for them. And there's others who are like, well, we don't need that. I'll look at it on a screen. But to hold it in your hand is truly remarkable. So let me unshare that and go back to the camera, which I guess everybody can see me, right? Would that be correct? So here's one example of a spine, incredibly complex. And a lot of the patients that we see are redo surgeries. So they may have had hardware that's going to be removed, or hardware that's been removed. And so we'll go through. This was done on our Ultimaker S5. It's about a 10-year-old patient that they're going to go in and place rods to keep the spine from getting worse than what it is currently. Can everybody see that okay?
Yeah.
Yep. Okay, great. All right. So this particular model, they could not sterilize. However, another I did, this was on a 4-year-old. This material we could sterilize. So they could take this, put this in the autoclave. And so when the surgeon goes into the operating room, in their hand, they can hold this, staying sterile, and determine where they want to go and what they find inside. So my orthopedic docs have had tremendous success with the models we've done. Another mandible that we have was mirrored. So this patient only had half the mandible. And what they wanted to know is, okay, can you create the other half for us? I said, we'll give it a shot. We did. And then the other thing is somebody always says, well, how do you know that that's accurate? How do I know that this matches what's in that patient? Well, for me, because I'm point of care, I go back over to the CT scanner and I rescan the part. So every part that I can rescan, I take this part, put it on the CT scanner, scan it, pull it back into my original software, and I can overlay and then register my model's data with the patient's data. And so at that point, I can find out, do I have a match? I can do measurements within the software to say, yeah, I match size. But in this case, if I can take an overlay and everybody looks as it should, then I'm good. And I have confidence that what I've handed the surgeon is accurate. One of the most challenging piece we found is to come up with a material that simulates tissue for surgery that they can cut into and suture. It's a work in progress for us, but we do have an elastic material that we can use for some of our pediatric hearts that will give a feel, but it doesn't cut or suture as nicely. And this would be off the Form 3. But the resolution is truly phenomenal. So we do it in halves so that you're able to clean out support material that's inside. We also will have cutaways, again, to scale of a pediatric heart or the patient that would have to go in surgery. So we have the two halves. Another piece there, and most of these I'll run on the Formlabs just because it's a easier print to clean up than soaking with water and PVA and scrubbing away the glue that PVA is as support material. Another one of our challenging cases is we'll have patients that they know they don't want to open them up. In this particular case, it's the left ventricular outflow tract of the heart, and they want to know when they insert this valve into the mitral position, will it occlude the outflow tract? So what I do is create that model so that the surgeon can look at it and get a feel for where does that model go, where does that valve go relative to obstructing blood flow. And this one's actually going to be picked up today to take a look at. So truly remarkable in that sense, because most of my patients on the adult side are not open surgery candidates. They're all going to be done transcatheter placements. And so if we can give them a model ahead of time, they get really great reference points off of it. So we've done several of these. And on the orthopedic side, I'm going to share my screen again. And this is an elbow that I had an orthopedic surgeon say, can you build me an elbow in anatomical position on this patient that I can flex and extend? Because they're 13 years old, had a tremendous deformity, and they wanted to go in and fix this young man's elbow. I said, I'll see what I can do. So we printed it on the Form 3, and I left it in the support material, and then fastened everything using the most elastic rubber bands I could find, and then screws and pins to hold it together. And in fact, the surgery ended up being highly successful because I mimicked where the ligaments were that surgeon wanted to have. So that worked out really well for them. And I'm hoping you are seeing a picture of the elbow on the screen. Okay. And let's see, I think that takes me to the end there. 1 second, let me make sure. Yep. And so I think that's my time for now. I'll pass that along unless somebody had a question that we could do. Hannah, is there anything else you need from me or fill me in?
So first of all, thank you so much for the insights and showing us your models and what you've done so far, and your talk, of course. And we actually do have, I think, at least 4 questions, 6, so we are counting up. So I want to please, everybody, try to post your questions, not in the chat, but the Q&A box, so we can actually track them. And I want to start.
Okay, go ahead.
Yeah, you're open for questions. No, I will. You just have to answer. I will do the rest.
Oh, so you have to read me okay.
Yeah, I will read it to you. If you
Okay.
understand me well, that's fine. For me then, if I'm understandable enough, then we can just do it
You
that
absolutely are, yes.
So, Andrew, why you couldn't sterilize the first spine model? What is it due to the material, right?
It's the material. So it's PLA, and the sterilization temperatures are above the melting point. And I know that my central supply people to do the sterilization would not be happy if they opened the door and found a puddle of melted plastic. So it's a melting point of the plastic is lower than what the heat is for the temperature.
Perfect. So we actually have another one to sterilization question. Did you consider ethylene oxide to sterilize the models?
So that has been considered, but we haven't tested that. The porosity of that material and whether or not you're going to get completely inside of it, and is it truly going to be sterile? We don't know for certain, but our workaround for that was to put the model in a sterile bag. So they lose a little bit of sense of feel and handling it, but they're still able to have it in a bag in front of them and look at it.
Okay, very nice. Okay, so next question. I'm sorry, I'm just gonna try to answer as many as possible.
That's fine, that's fine.
So there's a connection to the last event actually. Why not use, why not use 3D printed bone? Because